Kia ora koutou. I'd like to recap the progress that we've made since the vaccination program began on February 20, and also talk about our focus over the next couple of months. I'll then hand you over to Dr. Bloomfield, who will run through the latest figures for the vaccination program. The COVID-19 vaccination rollout is the largest medical event the world and New Zealand has ever experienced. We have a clear plan to ensure everyone aged 16 and over will be offered a vaccine by the end of the year. We are progressing well against the plan, which will see us steadily and then significantly ramp up the rate of vaccination as the year goes on. Rolling out a vaccination program of this magnitude is an enormous undertaking, and it's complex. We will face real challenges over the coming months, and I'd like to thank everyone who's involved. We couldn't do it without you. It's important to remember that we will have enough vaccine for everyone. To achieve our aim of having everyone vaccinated by the end of the year, we do need New Zealanders to work with us, and in some cases, to be patient. Collectively, DHBs are on track to deliver more than 1 million doses by the end of June. This aim aligns with the rollout plan, which follows a risk-based approach for providing access to the vaccine. By then, we will be well into vaccinating the 1.7 million people we've identified in Group 3. This group includes those in our populations over 65, people with underlying medical conditions, and our prison staff and the prison population more generally. But at present, our focus is on vaccinating the estimated 480,000 people in Group 2. This includes high-risk frontline workforces, staff and residents at aged residential care facilities, older Māori and Pacific people cared for by whānau, and the people they live with and their carers. This group also includes anyone who lives in Counties Manukau DHB area who is aged 65 or over, or has a relevant underlying health condition or disability. The 3 DHBs in Auckland are gearing up to start vaccinating this group from next week. Vaccinating staff and residents at aged residential care facilities is already well underway at the moment. There's some great success stories here in Wellington, where last week the Capital and Coast DHB vaccination team visited 4 aged residential care facilities, vaccinating 360 residents and staff. A 101-year-old resident was one of the first residents to be vaccinated. This week, the vaccination team will visit a further 7 facilities. All 42 aged residential care facilities in the Capital and Coast and Hutt Valley DHB region are on track for their first dose by Friday, 14 of May. The DHB is vaccinating in partnership with community pharmacy vaccinators. It's also that time of year when many people, especially seniors, are getting the flu vaccine. The Ministry of Health recommends a 2-week gap between the influenza vaccine and COVID-19 vaccines. Factoring in when flu injections are being administered in our aged residential care facilities is a major consideration for teams of COVID vaccinators. In my capacity as Minister for Seniors, I visited the Malvina Major retirement village in Kandala last week. They are offering their residents the flu vaccination first, so 14 days later, the residents will be offered their first dose of the COVID vaccine, and around day 35, their second dose. It's important that we have a well-trained and sustainable workforce ready to tackle the long-term vaccination schedule ahead. Outside our regular vaccination workforce of general practitioners and pharmacists, we're planning for an extra 2,000 to 3,000 full-time vaccinators. They'll be trained and available when needed throughout the country. General practice and pharmacy will play an important role in COVID-19 vaccine delivery, particularly as we roll out to seniors and people with pre-existing conditions who often have a strong connection with primary care. From July this year, as we move into Group 4 and begin immunising our general population against COVID-19, our vision is for more general practices, pharmacies, and other care settings and urgent care facilities to be able to fully participate in delivering the COVID-19 vaccine. These brochures advising people which group they are in and how to make appointments for their vaccinations are being distributed to all households in the country from this week. and some of you may have already received them. The brochure has a link to the Unite Against COVID website, where information on the vaccine program has been translated into 25 languages. A second link, also to the Unite Against COVID website, has information in 4 alternate formats: easy read, New Zealand Sign Language, large print, and audio. Finally, on Friday, I got my second dose of the COVID vaccine. It was a relief it didn't attract the same amount of attention that my first dose did. I would really encourage people not to hit the gym straight after getting the vaccine. I had quite a sore arm after lifting some heavy weights and a slight rash on my arm for a day or so. I felt a little tired, but otherwise I felt totally fine. I'll now hand you over to Dr. Bloomfield.
Thank you, Minister. Kia ora koutou katoa. So just to continue on the vaccination theme before moving on to other matters, as at 11:59 p.m. last evening, 232,588 doses of the Pfizer vaccine had been administered. A total of 172,564 people had received the first dose of the vaccine. That's an increase of just under 32,000 from a week prior. And a total of 60,024 people have received a second dose of the vaccine and are now fully vaccinated. So in the past 7 days to 11:59 Tuesday 27 April, we administered 47,981 vaccination doses to people, slightly higher than the previous week's total, and overall DHBs are tracking to plan. We're also adding to our stocks of the Pfizer vaccine in the country. We have received around 685,620 doses into the country to date, and that's enough to vaccinate more than 342,000 people fully with both doses of the vaccine. To date, we've received 295 applications for access to early COVID-19 vaccines for travel reasons on compassionate grounds. 124 of these were approved, while 107 have been declined and 64 are still outstanding and being considered. We've also received 488 applications from Sport NZ, including Olympians and Black Caps, and have 7 applications from Ministry of Foreign Affairs and Trade for people who are needing to travel overseas for reasons of national significance. The Minister talked about our preparations for starting vaccination of those in Group 3, and just to note that people in Group 3 can expect to receive an invitation for a vaccine from their local DHB. There will be a staggered approach to this as we progressively make our way through this next group, which is 1.7 million people, so it is sizable. It will begin with those who are over 75 and then move on to those over 65, people with disabilities and people with underlying health conditions who are under 65. DHBs have got flexibility in how they respond to the needs of their local communities. For example, in Northland, we saw them being flexible yesterday in administering vaccine that would otherwise have expired to people to make sure that the vaccine wasn't wasted. And likewise in Northland, where communities are spread out and take some effort to travel out to, it may make sense to vaccinate whole whānau or communities, and DHBs have the flexibility to do that. The important thing is that people are vaccinated. Our national online booking tool is currently on track to be available from late May to support the rollout of this substantial Group 3. So if you are one of the 1.7 million people in this group, please do look out for regular updates on the Unite Against COVID-19 website or your local DHB website. A word now on the person who recently flew from Australia to New Zealand, having been in Perth during the lockdown period there. That person flew from Perth to Sydney and then on from Sydney to Auckland, as has been previously publicised. The particular case is the subject of an ongoing investigation, and I won't prejudice that by discussing specifics at this stage. But what I can say is that, in general, any person who enters New Zealand who is ineligible for quarantine-free travel is required to isolate for 14 days in a managed isolation facility and may be subject to enforcement action if they have breached their relevant air border order. If a person is convicted of breaching quarantine-free travel requirements under the air border order, they could face a fine of up to $4,000 or 6 months imprisonment. In this case, there are a number of questions still to be answered about what has happened. We are gathering all the facts and answers to those questions, and the facts that are gathered will inform any next steps regarding penalties that may apply. However, I can say that based on the information we have to date, the risk arising from this person's travel to New Zealand is regarded as low. They had not attended any of the locations of interest in Perth prior to travelling to New Zealand. However, while it has been assessed as low, it does provide an important reminder that our response, our overall COVID-19 response, relies on accurate and complete information from people, and people fully complying with all the measures that have been put in place by both Australia and New Zealand. And we don't want to be in a situation where the actions of an individual jeopardise the quarantine-free travel arrangements for everybody. Regarding case numbers, there are no new cases of COVID-19 to report in the community today. Our case, who was the airport worker from last week, all close contacts have returned negative tests. There are 2 new cases to report in recent returnees who are in managed isolation facilities, and 10 previously reported cases have now recovered, so our total number of active cases today is now 27. One previously reported case has been classified as under investigation following confirmation that they had already returned a positive result in their home country before travelling to New Zealand. So our total number of confirmed cases is 2,254. It was a milestone over the weekend where we passed a total of 2 million COVID-19 tests having been processed through our laboratories, and I want to personally acknowledge that milestone, the work not just of our laboratory workers and all those who are involved in getting those tests completed, but those who have done over 2 million swabs of people around the country, our GPs, nurses and many other workers who have done those swabs over the last more than a year. And of course, I'd particularly like to thank all New Zealanders who have been tested and with a particular emphasis on our frontline and border workforce who are regularly retested. That's all I have, Minister.
All right, thank you, Dr. Bloomfield. Open for questions.
Regarding the Perth traveller, Dr. Bloomfield, what are the outstanding questions which still need to be answered?
Well, if we are wanting to consider whether there's any further enforcement action to be taken, we need to make sure all the facts are correct, and we're in the process of ensuring that that is the case.
So is that whether he knew that he was breaking the rules, that he lied? What are you actually investigating?
I really don't want to go into details, but obviously we need to be very sure about the travel that was undertaken, the actions that were undertaken, and the information that was provided as part of the processes that are required on both sides of the Tasman.
And are you confident in those processes as they stand, the rules as they exist right now?
I am confident. Minister, did you want to comment?
I think one of the key things about this case is that we've just reopened the Trans-Tasman bubble with Perth because we're reassured that with Western Australia, because we're reassured that the risk there is low. This particular person posed a low risk. And I'd just point out about the chain of events in this case that this person, who's not a case, was detected.
What conversations have there been with Australia about this case?
Well, you might want to comment on the liaison between officials.
As part of the gathering of information, there has been conversations, I understand, between our immigration officials in Australia. We haven't spoken specifically to our health counterparts because it's not so much a health matter. I would also point out that, and I think this has been traversed already in the commentary from my immigration colleagues, that the system did pick up, I think, over 70 people who had been from Perth and were prevented from onward travel to New Zealand. In this case, the individual wasn't picked up prior to landing in Auckland, but was picked up, identified, and health authorities identified, and obviously the person's been contacted in isolation, and I can confirm is now in a managed isolation facility.
In these cases where it involves Australia and New Zealand, do you think the intervention needs to come on the Australian side before they actually board the plane, as a matter of principle?
There are multiple stages at which interventions can occur, and we want to use this investigation to find out precisely which ones where there are gaps and fix them.
As a principle, though, when there are these Australian cases with Australian lockdowns, lockdowns, it should come before they board.
Absolutely, that is the principle that there are processes in place at the Australian side of the border by airlines who are flying into New Zealand to evaluate the risk of each traveller. Yeah, sorry, this colleague over there.
We understand that Māori have a pretty strained relationship with the health system as it is. There's only about 4% of Māori that make up those in residential care, and they die 10 years younger than everyone else. Are you just expecting that kaumātua and kuia Māori may fall through the gaps with the vaccine rollout, and what's the response to that to ensure that they are still reached?
We did consider the fact that aged residential care isn't a place where Māori are represented, and that's why there is a separate rollout through whānau-based providers where that whānau can access the vaccine, and often in a way where their people close to them who care for them will also be vaccinated at the same time. So rather than, so we sought to have a parallel process to address the fact that the Māori are not necessarily in aged residential care settings.
They don't usually feature though in a lot of places in rural New Zealand where Māori villages, Māori communities don't feature all the time. How are you making sure that that's actually happening? We've seen that surveillance testing at times has failed. How are we making sure that the surveillance of these kaumātua and kuia Māori is actually happening?
So we get reports on the level of testing in Māori communities and broken down according to ethnicity. And for the vaccination campaign, we have also reporting broken down by ethnicity. And what's more, we're rolling out the vaccine both in marae and also through whānau providers.
On the airport worker, have you had any further insight into how that person became infected?
Not as yet, no. The source investigation continues, as we've found in a number of these cases. And it's the same in Australia. It's not always possible to identify exactly how the person became infected. It's most likely it will have been through transmission of the virus when the person was cleaning the aircraft on which the index case, the person they got infected from, had been travelling on, but it's not immediately clear how that transmission occurred.
So have you changed any procedures of sort of a more of a stand-down period for planes before someone goes on to clean them, or have you made any changes to any procedures?
That's being looked at, and what I can say is that the cleaners cleaning planes, whether they are planes just flying trans-Tasman or flying further afield, are wearing full PPE, including P2 masks, and they change that PPE between planes. So that was already in place, and of course, as we do with any of these cases, we'll look and see are there other ways we could strengthen those protocols.
Are cleaners still doing red zone and green zone planes?
I don't know the answer to that, but that's something that will be looked at.
How big are logistical challenges of having that flu vaccine rollout as well as the COVID rollout at the moment and having to have that gap between them?
It can be taken into account in the program we currently have. The crunch point is for people being offered the flu vaccination and COVID now, which is mostly seniors population. And this is why we've been clear from the start that the sequencing framework is not to be followed dogmatically, but providers and DHBs on the ground can make pragmatic decisions to look after their patient well.
In terms of the COVID vaccine rollout, are you on track with where you thought you would be at this time, or how's it going?
Yes, we're just ahead of track, I think 3% ahead of where we were tracking.
Dr. Bloomfield, the data release last week, obviously the new data is not actually out yet, the data release last week said Northland and a few other DHBs were greatly behind plan. So while some DHBs like Southern are doing a lot more than they planned, Northland was a lot back. What's the reasoning behind the DHBs that are behind, and do you know if they are kind of back on track yet?
Yeah, so we would always expect some DHBs to be a little behind, and some, most of them are ahead of what their plans were. So those plans are publicly accessible, as you know. The ones that are behind, we follow up with once to find out what might be the reasons behind it and what they're doing to catch up.
61% last week. It's not, a little bit behind, but it's almost half as much as they wanted to be doing. Have you sought an explanation from them about what that was?
Yes, the team in charge of the program had a conversation with them last week to find out what was happening there, and as we saw yesterday, actually there was a big effort to make sure that the vaccines that were available there were being used.
Obviously, so to sort of speak to India, obviously the situation there is escalating rapidly. Are you sort of able to sort of share some thoughts on sort of the situation there and what we're seeing?
It's an extremely distressing situation, what we're seeing in India, and I think about the people there, and also I think about the healthcare workers there who are struggling to look after their patients well in extremely difficult circumstances. New Zealand's expressed its concern about this, and I know Minister Mahuta is in discussions about how we can help.
Minister, what do you make of New Zealand dropping to the lowly ranking of world number 2 in the Bloomberg measured COVID resilience index?
That's still a very good ranking, and I think I'd just point out that we have some of the best statistics when it comes to COVID public health outcomes in the world, including incredibly low numbers of deaths and enjoying a great high level of community freedom within New Zealand and trans-Tasman travel.
Can I ask another one, just to change topic slightly? The National Party has pledged to repeal the National Māori Health Authority that your government is going to put in place with its health reforms. So I thought I'd ask, why does Labor believe that this independent authority is going to deliver, or is important to deliver Māori health outcomes?
It's really important to note that we have persistent and long-standing severe health inequalities in New Zealand, and many of the things we have tried have only made small levels of progress against those inequalities. We think that by having a structure that gives a voice to Māori in the institution, that will mean that their needs will be prioritised. And giving it commissioning powers means that when there is decisions about money to be made in the health system, the question is how can we use this money to also improve outcomes for Māori?
Do you draw on your experience as a GP for that?
As an infectious diseases specialist, I have certainly seen the outcome of inequalities in our health system result in Māori grandparents dying too young and leaving behind tamariki who could have benefited from many happier years with their grandparents. And that's what that difference between Māori and Pākehā life expectancy means in practice.
Māori health providers in the north are saying one of the barriers that they're facing is the vaccination registration process. With no suitable internet connection, a lot of whānau don't have access to cell phones or laptops. Will you be looking at maybe simplifying that process or changing that process?
Yeah, look, the DHBs are really aware of what they need to do to make sure that those communities, those more remote communities, are able to access the vaccine. And again, we don't subscribe to this notion of people or communities being hard to reach. The obligation is on the system to reach into and out to those communities, to work with iwi and to work with providers to make sure that there aren't those barriers. And my expectation is, and I know that the Northland DHB and other DHBs with like Tairāwhiti with those remote populations will be reaching into those communities. And in fact, we saw this happening successfully when we did need to increase testing rates amongst Māori communities. We saw those rates going up very well with the use of mobile clinics going up.
The main vaccination centre in the mid-north is Kerikeri, and there's no public transport there for the outer lying areas. Is that a concern for you, or will you be looking at maybe standing up more vaccination centres around the mid-north?
Yeah, that's the responsibility of the District Health Board. I would say that's the main centre at the moment in the mid-north, but they will have plans afoot to extend out from there and to make sure that there are other centres and other towns up there, Kaikoi, Kaitaia, but also to be able to reach out into those more remote communities so people don't need to travel.
Will you consider, will you consider maybe mobile testing for places like Verrall?
Mobile vaccination, most definitely, and that's already happening in a number of DHBs around the country. And Mr. Verrall talked about the teams going into aged residential care settings. That's a common model that DHBs are using, and those teams will then be available also to reach out into remote and rural communities.
To the situation in India, for our New Zealand cricket players over there playing at the IPL, are they, and if there is a possibility they want to come back to New Zealand, will we have queue spots available for them to come back, or will they have to go in queue like everyone else?
So the New Zealand cricket players will be New Zealand citizens who are able to enter under the very high risk country framework, and you'll be aware that Minister Hipkins has repeatedly said that we have space in the managed isolation facilities and free vouchers at the moment.
And just, is it possible, Dr. Bloomfield, to get the update on AstraZeneca and Johnson & Johnson's approval process for MedSafe? They've been, they've asked for advice for more information on that. How long does that usually take, and is it months, is it weeks, or are we likely to see approval for these two vaccines?
Speaking to Johnson & Johnson, the J&J one, that will be several weeks, so 2 to 3 weeks is when they're expecting to have the information back on the Janssen vaccine, and then that will help inform a decision around the approval for that vaccine. Did you ask about another vaccine as well? AstraZeneca, I don't have an update on where that one is at in the process.
I do. It's available in June.
How many border workers and MIQ workers have still yet to be vaccinated?
The data I saw yesterday was that 95% of the workforce in MIQ is vaccinated. A proportion of those who haven't yet been vaccinated have vaccinations booked, and you'll be aware that from 1 May, every worker working in MIQ facilities will need to have been vaccinated. Furthermore, the additional functionality to the Border Worker Testing Register went live last week, which allows employers who are now required to have their employees on the Border Worker Testing Register. It allows them to go in and check the vaccination status of their employees.
Is staff already being moved off the front line, or is that going to happen on May 1 date, or how's that working?
I imagine the planning is well underway for that, and some staff may have already been assigned to different duties.
Can I just ask a follow to Anna's question about K-means and whatnot? I mean, they went to India knowing the risks, and now they're coming back. There's obviously space in MIQ, but there's a long list of people that can't get into MIQ, separated families and whatnot. Do you reckon everyday Kiwis will cop the fact that stars effectively get star treatment?
So the rule is that citizens are able to return. That's the rule, and also that permanent residents are able to return if they have 14 days in a very high risk country. So there is an avenue for others to return as well. Sorry.
Should citizens?
Could you just add a bit more to that AstraZeneca in June statement you just said?
We anticipate that it will be able to be on track for June, but of course if concerns come up between now and then, they'll have to be worked through.
So you're expecting a decision by June, or you're expecting an actual...
It's currently tracking towards a decision in June.
And you have enough on that you can start straight away? If a decision was positive, could you start using AstraZeneca immediately?
We don't currently have a plan for that, so I will have to, that would depend on whether we had a second decision made by an expert clinical group about the role of that vaccine in our overall vaccination program. So it is not just a matter of MedSafe saying it is safe, it is a matter of there also being a considered clinical approach to which populations in New Zealand would be best to have it, and about the timing of when it is available for use.
Further to Ben's question, should New Zealanders be travelling to India at the moment?
There's a travel ban on travel to India at the moment. So the do not travel advisory for travel overseas.
And so should New Zealanders just shouldn't be there, given advice?
That was in place for the start of the IPO as well.
Yes, and they were given an exception based on there being a small group who we could have a manageable plan for.
Will you be approving any exemptions at Director General for New Zealanders to travel to India at the moment?
I don't approve exemptions for people for outbound travel. That's not part of my powers or obligations. But as the Minister said, there's a very strong do not travel advisory to India, and I think everyone will be aware of how perilous the situation is there at the moment, and actually the global effort is on supporting India to really get on top of what is a very, very extensive outbreak.
Do you know how many border workers outside of MIQ, frontline border workers, are not vaccinated?
I don't have the numbers with me. What I would say is that...
Do we have eyes on that?
Well, we will have eyes on it when all the employers who are now required to use the Border Worker Testing Register have got the data in that register, and then we will be able to match the names of all those employees in that more than 500 employers with our the data on our COVID immunisation register, and that will give us a much better idea of the proportion, because we will have a clearer view of the denominator, notwithstanding that the denominator does change. Because
but we do know that there are about 10,000 border workers, not MIQ, who do need to be regularly tested.
Yes.
Do we not have a ballpark figure on how many of them are not vaccinated, given that it is only a couple of days before they will need to be redeployed?
I'll have to come back with you and see we can. I will get the latest data, and we'll make those available.
A follow-up on that.
Speaking of the latest data, the Ministry of Health's website still has not provided vaccine data for today, so the only questions we can ask you are based on data that's 8 to 12 days old. Of course, you provided a few numbers at the start, but why is the Ministry not updating the website ahead of these 1 p.m. press conferences, given they're only once a week, and if we miss sort of that window, we have to wait another week to ask you with the data we get?
Well, two things there. One is we've always announced the latest numbers at these stand-ups as they're related to cases, and then made the information available on our website, and we're following that same pattern with the vaccine information. Secondly, of course, we're always open to, we receive and we respond to follow-up questions related to the information when it is provided. If you've got specific questions now, I'll see if I can answer them, because I've got some other information I could speak to if you've got a very specific question you want to ask.
Given we don't have the data, then can you, and you seemingly do, can you tell us which DHB is performing at most below target currently, and how much that is?
That's not information I've got here, but it will be on the website. Yep.
Has a traveller from Perth in Northland, has he been tested?
He was tested in Perth, is my understanding, prior to travelling out of Perth and flying across to Sydney, and that test returned negative.
Has he been tested since he arrived in New Zealand?
Not at this point. He's now in a managed isolation facility, and so there will be testing done there, which will be the regular day 12 testing as part of at the appropriate point since his potential exposure.
Let's take our final question.
We've received reports that workers at the ports of Tauranga haven't received surveillance testing, they haven't received their first dose of the vaccination. Obviously, we don't have the numbers. At what point should the government intervene, and what point should the Ministry of Health intervene and just get it done?
Well, if you provide us with the details of those people, we'll look on it immediately. Great, that was our last one. Thank you very much. Go ahead. I'm a softie.
What's your PV? What do you press?
You should ask how many reps. That was a slightly more impressive number than the amount lifted. Thank you.